Toenail fungus is a very distinct look. Oftentimes the nail is thickened, really looks like a thick nail, thicker than usual. Often the nail is yellow, or it might be kind of white or darker color, like it's not a typical normal color. You may also see flaking of the nail, like the actual nail like flakes. And sometimes the nail kind of slants up. This is your, the nail can actually start pulling up from the nail bed and sort of slanting upwards. The nail can break and sort of be very brittle. And the other thing is debris under the nail. So a lot of times when people have thickened nails with toenail fungus, underneath the nail, there's a lot of debris and like sort of gunk under there, okay? Yellowing is a huge one, okay? And oftentimes, if you have toenail fungus, write in the comments if you've ever had to deal with this. I've had patients like that don't wear flip-flops or won't wear summer shoes because they're embarrassed about showing their feet. So that's why we're talking about it today. Toenail fungus is contagious. That's right. Did you know that? It's caused by fungus, okay? But it's contagious. So in other words, if you have toenail fungus of one toenail, it can spread to other toenails. It can also spread to skin. Guys, I'm Dr. Jen. It's good to see you. What are some ways that we can get it? First of all, this is an infection, okay? It's caused by a fungus. A fungus is a type of thing, okay, that can infect us. And oftentimes we see fungus grow or thrive in damp, warm, moist environments. So what am I talking about? Places like gyms or saunas, steam rooms, pools, things like that, where there's water, there's moisture, it's warm, etc. That's probably a big place that a lot of people pick up toenail fungus or fungus infection. And remember, if I didn't mention it before, toenail fungus can spread to the skin. I think I said that. I'm not sure. But anyway, gyms, pools, etc. are big places that you can get this from. This is why, and I'm going to give you a pre-tip tidbit. Wear flip-flops. Please wear flip-flops, shower shoes, when you are going to the gym, when you are walking around a pool, when you are walking around in showers and things like that. It totally matters, okay? And this is not just about being a germaphobe and being extra like, oh my God. No, it's about hopefully preventing like a fungal infection, such as a toenail infection. By the way, there's a medical word for it. It's called onychomycosis. That's right. Other ways that we can get it from sharing infected tools. What do I mean by that? So if you go to a manicure spot or a spa or whatever, and they're using tools that are infected with fungi from another a client, you can get it if those same tools are used on you and not disinfected. Same thing with the tools that you may have at home, toenail clippers, fingernail clippers, and things like that. That can happen. The other way to get it is you can get it through contact with other people. Okay, remember, because fungus can be spread, right? It can be spread between people. It can spread to other nails. It can spread to your skin. And so if you have someone in your household that has it, it is potential. It's possible for them to spread it to other people in the household through contact, etc. Another thing is if your nails are just wet a lot. Wet nails can predispose you to getting a fungal infection. And that is not necessarily due to any contact with anyone else, okay? So those are some, that's not all the ways that you can get a fungal infection, but those are some. I keep going back to the fact that it can be contagious because I also want to remind us of the importance of, once again, treating these things if we have them. All right, now let's go into treatments, because I have a feeling that a lot of you might be here because you want to know how to treat this if you get this. All right, and then I'm going to talk about prevention at the end, like ways to keep yourself from getting this if you don't have it. All right, so treatment. First of all, if you got toenail fungal infections, do not cover it up with nail polish. Okay, let's not do that. All right. What you want to do is get some treatment. Now, there's a couple different types of treatment. One is topical treatment. There are often sort of medications that can be applied to the nail, almost like with a brush, like a nail brush or things like that. These treatments often tend to require use for a long time, and they have to be used correctly every single time. And sometimes they don't work as well as another type of treatment. That's what we call oral treatment, treatment by mouth. Okay. And I've certainly given a number of patients throughout my career as a family doctor the oral treatment by mouth. Sometimes we have to be really careful with these medications in terms of we have to check certain labs. We got to make sure there's no medication interactions with other meds you're on, blah, blah, blah. But the oral or by mouth medication tends to work the best, okay? So I'm telling you this, first of all, so that if you have this, you need to go see your doctor, go see a podiatrist, go see a dermatologist, start with your family doctor, what have you, so that we can kind of get you started on the right track. Sometimes in making sure that it's a fungal infection, because remember, there's a number of things that can discolor your toenails, right? It's not just a fungus. So sometimes doctors will want to take a clipping of the nail and send it off and make sure it's actually a fungus, okay? In severe infections, like in some cases with severe infections, if the nail is so infected, sometimes the toenail actually has to be removed so that adequate treatment can be applied. And of course, those are cases that I would be referring to a podiatrist, etc. Okay, so yes, there is treatment, but I would say in terms of toenail fungus, a big part of the treatment is prevention, keeping you from getting in this spot in the first place. So let's go back, okay, to those common places that you are sharing with other people, whether that's a shower room, a gym, a locker room, public showers, swimming pools, things like that, hot tubs. Wear some flip-flops. Don't be going all willy-nilly without flip-flops, okay? Protect your feet, protect your toes, protect your toenails, okay? The other things that you should be doing is trying to keep your feet dry, because remember I said lots of moisture can predispose you to getting a fungal infection. So if you got wet socks, you routinely work or sort of kind of stay in wet socks, don't do that. Change them. Get out of them. Wear a material that helps wick away moisture from your feet. Change your socks when they get wet. Also change your socks every day. Do not repeatedly wear worn socks, okay? Clean your socks. Wash them. That's really important, okay? The other thing is your shoes. You don't want tight shoes or shoes that don't breathe very well, because that could sort of create an environment where fungus may be more likely and happy to grow, okay? So stick with leather, canvas, or mesh, okay? Or some types of shoes like that. By the way, these tips are from the American Academy of Dermatology. So your shoes, the types of shoes you wear is going to be super important. Keep your nails short, okay? Keep them short and make sure that you're cutting them square, like just make sure that you're not predisposing your nail to ingrown toenails, okay? So cut them straight across. You want to use properly sanitized nail cutting tools. Make sure that they're washed, and then you want to sort of put them in rubbing alcohol, soap and water, and then rubbing alcohol to make sure that they're clean. Don't share tools and things like that with other people. That's going to be important, all right? And then if you have, and I think this is a really good point that the American Academy of Dermatology makes, is that if you have athlete's foot, make sure it's treated, because that infection can spread to your nails as well. Okay, so you want to treat that as well. American Academy of Dermatology also recommends, like, once you finish treatment, throwing away the shoes that were worn before. I think that's very interesting and something you want to talk with your doctor about. But the idea is make sure that you're using good hygiene practices, you're drying your feet, you're taking a look at your feet so you know what's going on down there, and that if you think you have a fungal infection, that you see a doctor to get a proper diagnosis and treatment. Guys, let me know what you think of this video. Share this video with other people. Let me know, how was it? Was it helpful? I'm Dr. Jen. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel. Click the little bell for updates. I'm on LinkedIn, WhatsApp, TikTok, Instagram, etc. at Dr. Jen Caudle. Please go to my website, www.drjencaudle.com, to sign up for my free health newsletter. Love you. Bye.